think I'll do some more physical therapy, see what we can get done, see how this starts to heal.
Love it.
And then maybe circle back in like 6 months.
Yeah, sounds good. And then again, like, it's all valid. I think it's important for you to sit with your body and decide what's right for you. And I'm not threatened by that. You know what I'm saying?
That was one of my favorite parts about coming here today. I was literally thinking, I'm like, how exciting that I'm going to be able to tell you everything that I'm feeling, and I'm not afraid. I'm like excited to talk to you about this.
That's better than a great surgery. You know what I'm saying? Yeah, that's better than a great surgery. I'm really proud of your result, like really proud of it. I think it looks beautiful, but I'm also really proud of you for the way you did this. Like the integrity, the way you didn't do it when other people couldn't have their deeps, the way you waited for Redbud, and also the way you were really honest about the healing process, right? And yeah, I mean, I think as a surgeon, sometimes it's hard to say, like, that was really messed up. But you knew it was. You were living with it.
Yeah.
So, you've done an amazing job.
Thanks.
Proud of you.
I'm grateful to be where I am. I wanted to talk to you about 2 things.
Yeah.
But I want to talk directly to the community if you're okay with it.
Totally.
Is it actually better to do over the muscle versus under the muscle? It's not what I think is best. I think people should be able to answer this question for themselves. You think about the actual surgery. When you go under the muscle, they're cutting your muscle, right?
Yeah.
So the integrity of your body, the integrity of your muscle is getting, actually, it's kind of graphic, but like they're slicing the muscle and they're putting the implant underneath it. Versus, explain to us what happens when you go over the muscle.
Over the muscle, the muscle stays in like the anatomic position, kind of like where my hand is, and the implant sits on top of that. Back to the slicing of the muscle. So there's 2 places where the muscle might get cut. Pec is attached at the sternum and also at the clavicle and at the humerus. This was cut at the sternum. I had to fix it back down near the sternum. The implant was slid underneath the plane between your pec major and pec minor. And so that wasn't so much of a cut as it was like a violation of a plane that it didn't want a foreign body in it. But you didn't have to cut the muscle to get into that plane. The muscle was cut in the middle, and then the muscle was stretched by the implant being underneath it.
What's the other way of cutting the muscle?
The 2 places would be here and then along the bottom of your rib. So like your pec muscle had been attached at the middle as well as at the sternum. And so that whole C shape was cut, and your pec retracted up really, really high, peeled it down and put it back into place. And that's what hurt so much when you were healing.
These are great questions to ask. Like, if you're going to have under the muscle, where are you cutting my muscle? How are you actually doing? Like, I've never thought of asking this. I thought there was just one way of doing under the muscle.
You would think that there's one way, just under the pec major. You also had your serratus muscle lifted up, so not just your pec muscle. Little juncture of your pec major muscle and your serratus muscle. And because your serratus was lifted up with your pec muscle, that allowed for your implant to fall towards your back. So there was another sort of like border that was violated there. And that's a known way of placing an implant. It was supposed to be something called total submuscular coverage or total muscle coverage. But you had this sort of strange mix of your pec had retracted up to the top and your serratus was flipped over to the side too. I hadn't seen that specifically happen before.
So when you're explaining this to me right now, remember I told you sometimes my implant, like my chest hurts, my implant?
Yeah.
This hurts right now.
Yeah, your body's connected to that.
Yeah, like it.
Yeah, I believe that. No, I mean, imagine you had, so your muscle on your body here wants to be up against your ribs, and someone put an implant so that it pulled that muscle away from your body. It wasn't attached up against your body.
Yeah.
Yeah. Yeah.
Oof.
Yeah. Yeah, I think as doctors, we need to not be doing that. We need to stop that. Stop with the under the muscle anything. It's not good for women. It's not. Doesn't feel good. Disconnects you from your core. we can do better.
Yeah, thank you so much. I'm so glad that I didn't try to explain this myself, because I didn't even understand all of this. I feel like I still need to like
Process that.
really process and sit down and be like, wait, whoa, I don't understand everything you just said, but I want more people to know what could happen to them too.
It's less common to go under the muscle now.
I'm getting
You're getting this message out there.
No, I have like,
People are still
even
doing
yesterday alone, I don't want to exaggerate, like I think I had probably 22 or 23 messages alone, which is not that many, but
it's a lot.
Asking
It's a
me
lot. Yeah.
directly, like, did you have over the muscle or under, like asking me directly about my surgery and what did I have, and because they're having these conversations with their surgeons right now, and people are telling them that they should go under the muscle still. I'll show you the DMs, and like these conversations are happening right now. So it is happening, and people are being convinced to still go under the muscle.
I don't know. Do I look tired?
Yeah. Sorry.
Like,
no, I know. I didn't mean to put this all on you.
No, I didn't know. I mean, tired like of. I don't even know what to say to that.
I don't either.
Like, there's a million ways that you could explain to someone where under the muscle could be better. And I think they're all compromising the truth. Someone might say going under the muscle is better because the mastectomy flaps might be really thin. I think that if your mastectomy flaps are so thin that you're worried about the implant, that you probably should just not place an implant or a tissue expander that day and come back in a week, rather than go under the muscle and affect a woman's strength for the rest of her life.
Yeah.
I don't think under the muscle is better for patients. So I think that sometimes under the muscle, doctors might say you'll see less rippling. I think most women, if you said, hey, Paige, would you rather have rippling or would you rather have your muscle where the universe put it?
Oh my God. I couldn't care less about rippling.
Yeah.
And I barely have any. Right. I do have some, but like I'm not even thinking about that. Right. Based off of having lived with both now. You cannot compare the two experiences.
You were never given that option, and I think that most women aren't given that option. And I think that a lot of plastic surgeons are convincing themselves that under the muscle is safer, because if the mastectomy skin is thin, then there's more between the skin and the implant. And again, I want to say, if the mastectomy skin is so thin that you're worried about the implant getting an infection or being exposed, a better option or a conversation that you could have before mastectomy, and I have this conversation with patients, is if I'm worried, I'm just not going to place the expander at all, or I'm not going to place the implant at all, and we'll come back later and put the expander in. So I place expanders in Reconstruction, not direct implant, but I routinely have that conversation with patients where I say, hey, when I come in, we're both gonna hope your surgeon did a great cancer surgery. Sometimes that injures the skin. If it's injured, I'm not gonna place the expander. Instead of, I'm gonna put it under the muscle. Because that changes your body forever. And we've walked it back for you, but that was almost a year of recovery to walk that back.
Yeah.
So, yeah.
No, it's so true. Wow. No, and I'm like just sitting here also thinking about, it's overwhelming to explain all of this to people right now. And like even you explaining this to me, I'm like holding back emotion.
Yeah.
But like I also feel an overwhelming sense of responsibility to get this information out at the same time, you know?
But I love that. I also think that you like me, we're not trying to say anybody is, I'm not even gonna say that. I'm not gonna say what I was gonna say.
Well, yeah, because I feel like you're gonna say that it's nobody's fault or no one's trying to do anything wrong, but at the same time, it's so complicated, it's so nuanced. When I'm like, even hearing you explain what happened to me, I'm like,
why?
Was something done wrong to me? Like, should I? And I don't have to include this, but like, you know, like.
You can include it. No, I think this is like the conversation we've had recently about being a good doctor. So the question isn't, we don't really need to talk about whether your doctor is a nice person. It really doesn't matter. Your doctor's job is to be a good doctor.
Right.
And I think right now, the message that I want to give to other plastic surgeons is, let's have submuscular implant placement in Reconstruction, be lower on the list of options. Put other things ahead of that. Put in front of the muscle ahead of that.
Yeah.
Put just waiting ahead of that. Yeah. Let the patient choose instead of you.
Yeah, I love that. Thanks for answering this.
Of course. Oh, what a difference 10 months makes.
I was just saying, I'm like, you guys are light workers, because it's crazy, like, how you manage people coming in and feeling like the whole world is over, and you're so, like, things felt so dark for me, and I was, like, in so much pain, and I felt like I was never gonna get to the other side, and then now I'm like, I feel amazing in my body, and I feel like I just, like, never thought it was gonna be possible to feel this good.